This documentary is made possible by the generous support of the American people through the United States Agency for International Development, or USAID. The contents are the responsibility of FHI 360 PNG and do not necessarily reflect the views of USAID or the United States government.
FHI 360, with funding from USAID, implemented strengthening HIV/AIDS services for key populations program in Papua New Guinea for the last 6 years. The project has been implemented in partnership with the PNG government, international and local NGOs and faith-based organizations, other donors and UN agencies. The success of the project are a result of FHI's partnership with its stakeholders. This short documentary presents the work of FHI and partners.
USAID is proud to support the National Department of Health in its efforts to control the HIV epidemic through the Strengthening HIV Services for Key Populations project. Under the leadership of the NDOH, it has focused on vulnerable populations that are hidden, subject to stigma and discrimination, gender-based violence, and HIV. The initial activities were through direct service delivery in health facilities, supporting HIV prevention, counseling and testing, and care and treatment. This often required intense work in the community to detect and follow up patients. It also required special attention to gender-based violence, common among these populations. We are also proud to have supported the development of guidelines, protocols, and other tools to improve health systems. We hope the experience acquired in this project will go a long way to further improve the responses to the HIV epidemic.
The understanding and the concept of continuum of care was very difficult, not really well understood, only in certain places. And FHI coming in the HIV space, and especially on treatment, was a very, very important step.
To create demand for HIV and STI services among the target groups, more than 14,000 key populations and 11,000 other high-risk individuals were reached with a minimum prevention package, which included referral for HCT and STI services in Madang and NCD. During the early phase of implementation, the project struggled to meet its performance targets. However, with the introduction of the enhanced outreach approach in fiscal year 2015, targets were surpassed in subsequent years.
The project empowered me as a peer educator and also a member of the key population. I was trained as a lay counselor, and when I was out in the village, not in this project, I was doing risky behaviors. But when I joined this project as a peer educator and also a key population member, when I go out to the community for my peer interventions or site interventions, I do give information of HIV, STIs, and gender-based violence.
The proportion of key population among individuals reached with the prevention package also increased from 39% in fiscal year 2013 to 70% in fiscal year 2018.
One good feedback I have here from my peers is the clinic is very friendly and is given the best service treatment, especially on the STI treatment, and also knowing about their status on HIV testing.
Additional innovative approaches such as the 4-3-2 and 5-4-3 strategy helped improve successful referrals of key populations for HIV and STI services from 4% in fiscal year 2016 to 62% in fiscal year 2018. Through clinic-based and mobile HIV testing and counseling services, which included lay counselors assisted testing and innovation introduced by the project, more than 28,000 individuals were reached with HIV testing services through direct service delivery support. 71% of them being populations that are most at risk of contracting the virus.
Here at Koki Clinic, majority of STI patients with their partners were treated and cured. And secondly, there are more GBV survivors accessing GBV services than before. And thirdly, more HIV patients are put on ART and are being monitored closely to reduce the amount of virus in their body.
More than 10,300 were also reached with STI management services, 80% of whom were also people most at risk of getting HIV infections and other STIs. Of the 1,417 people living with HIV identified through direct service delivery support, 60% were registered into the HIV care and treatment program and 86% initiated on lifelong antiretroviral treatment. A total of 467 PL-HIV was still alive and receiving antiretroviral treatment under the project in NCD as at June 2018. Project results also indicate that 85% of the 52 PL-HIV were evaluated for viral load in direct service delivery clinics between April and June 2018 and have also attained viral load suppression.
Calgary Clinic was very outstanding in all the services that I saw it provided for some of us ART people. For myself especially, I really learned a lot from Calgary Clinic. The most important was the ART, the purpose and the functions of taking ART, why I had to take it, how often I have to take it. If I don't take it, I was told or I learned, if I don't take it, it will cost my life. But I'm very, very grateful that Calgary Clinic was the outstanding clinic that provided all the services that I needed, especially with AR supplies, trainings, conduct trainings, KBWs, and most other things, all recreational activities, so many things. I really appreciate them.
With the integration of GBV and HIV and STI service in fiscal year 2015, an increasing number of GBV survivors access post-GBV clinic care, increasing from as little as 41% of survivors receiving clinical care in fiscal year 2015 to 98% in 2018.
When I was 14 years old, I was forced to marry to a man where I didn't know by my parents. They used up all their money for other purpose, and they had to force me to get married when I was supposed to complete my education. So coming out from that situation where I was forced to have children without my consent, and where was I to go? I wanted to be free. It was only last year when I was 30 years old when I realized that something had to be done, that enough is enough. Under my parents' rule, under my husband's rule, I had to come out. So I had to get access to House of Hope, where I came. They helped me to get to court. They helped me and also to go through a house marriage training, where now I'm working and I'm able to take care of myself.
Many more beneficiaries also access HIV test, care and treatment and post-GBV services through technical assistance provided to 7 other HIV clinics located in NCD. Through technical assistance in NCD Health Services in collaboration with other partners including CDC and Global Fund, the project improved reporting among HIV clinics in NCD. Through combination of activities, the proportion of expected reports submitted timely by HIV clinics increased from just 15% in 2016 to 88% in 2018.
The technical assistance provided by FHI 360 has actually done many good things for NCD Health Services. So these are areas in helping us to establish ART sites. It has also helped us to in doing our M&E planning activities, and which actually helped us to improve our SaveForms reporting. FHI 360 has also helped us to implement the active case management program, and in that they have employed a staff who has actually helped to actually provide the services for NCD Health Services. The other areas that they have helped us include training and mentoring of our staff.
I would like to thank government of PNG for the partnership and PEPFAR and USAID for the technical and financial support.
USAID and FHI 360 PNG would like to thank the following key partners for all their support which contributed to the successful implementation of this project: National Department of Health, NCD Health Services, National AIDS Council Secretariat, Madang Provincial Health Office, Modulon Hospital, the Salvation Army, Foursquare Living Light Health Services, Family Sexual Violence Action Committee, Child Fund, IGAT Hope, Friends Frangipani, and Couple Champions.